Let me try. Thank you for that.
So I'll
No,
stop
first of
sharing
all,
my
a
screen.
big thanks to Vineet for his very, very generous and kind introduction. I think that is very, very kind of him. Bala sir was my role model way back, as he said, since my postgraduate days. So he was my role model, and he continues to be the role model for many of us. And whatever we do, we just emulate him. We think like what Bala sir would do in his situation. And in fact, when I was doing the live workshop, it was his wisdom which helped me to get across the first case, which was very, very challenging. When I was struggling to cross the lesion, it was his wisdom which told me to go with a coronary wire. And Suresh Magasari sir, I think he's a fatherly figure for all of us. I've been bumping into him whenever I go to US. He's a very, very warm and nice person, and he's heading one of the most busiest vascular access centers in Texas. Uh, he does almost like 6 to 7 access procedures per day, and we are really blessed to have him in Inform. And I think our younger generation will definitely benefit with his expertise. So I would like to extend a hearty and warm welcome to Suresh sir. And now let me start my slides and start my presentation. Um
You'll be
in
sharing
fact, we
screen.
had done 16 abstract presentations in this meeting. Our fellows had enthusiastically participated in this year's meeting, and it's very nice that Atish is there to present his abstract. Atish is next interventional nephrologist is making. He has all the traits to become a great interventional nephrologist, and I'm sure these chaps will do much better job than us. The way they approach the cases, his sincerity, everything. So let me start my presentation. So some of the abstracts were already discussed in Inform. So I thought that I would start with a abstract which was not discussed in our meeting. So this was one of the oral presentations which we did in ASDIN meeting. So this is an experience with SQ53, a novel patented antimicrobial solution in the management of long-term and medium-term central venous catheters. So Dr. Anil Vaidya sir was the pioneer who came up with this molecule SQ53. Currently, there are trials happening in Cleveland Clinic and Mayo Clinic as well with this molecule. So we had done this study long back, like 3 years back. So I'm just presenting this. Oh. So basically, we wanted to describe SQ53, a novel patented biocidal antimicrobial solution with a special focus on bacterial and biofilm formation. We also wanted to discuss our experience with the use of SQ53 in patients requiring intermediate to long-term therapy. So the patients included in this study was on compassionate grounds from October 2016 to date. Our institutional research board approval was obtained for the use of SQ53 in appropriately identified population. Then patients requiring patients were deemed suitable to be included in the study on compassionate grounds if they needed long-term CVC catheter and had 2 line infections or more within a span of 60 days. And these admissions should have required, these patients should have required hospital admission and change of the line. So such patients were included. Then what is SQ53? It's a novel patented biocidal antimicrobial solution. It is obtained in different concentrations. So we can use this as a hand rub. We can use this as a wipes. And it has been tested against wide range of bacteria, virus, spores, and fungal pathogens. And there was extensive laboratory testing that was done. So in fact, Southampton University, Oxford University were involved in this, and that's why the name SQ53. So it is used in cleaning the surfaces of the catheter over 24 hours plus time period. In addition, there was no non-colonizing population also that was grown here, like viable bacteria, non-culturable bacteria. Then what we used was a sterilized pack which contained single Y, which could be cut into 2 pieces and used before catheter insertion and after catheter insertion. So this is basically the composition of SQ53. These are the various compounds which were used in SQ53, and this is the wipe that was available. This is how the wipe looks like. So we used SQ53 at two timelines. First one was as an adjunct to clean the site of puncture during CVC insertion. The second is once we had already inserted the catheter, we would clean the site, the catheter, and the hubs every third day. So how do we use the wipe at the time of insertion? The site of insertion was prepped under sterile conditions and the solution was used in the CVC package. Then once we cleaned the puncture site with this SQ53 wipe, then we also cleaned the radius of around 10 centimeters from the site of puncture thoroughly with this SQ53 wipe. Then for the purpose of continued cleaning, like when the patient presents for a maintenance hemodialysis, so the wipe used to be cut into two pieces. First piece was used for cleaning the entire area, like the regular catheter cleaning. And then after during closing, we would use the other wipe. So we made sure that we covered a radius of 10 centimeters during our beginning and closing of the dialysis. So these are our results. From October 2016 till date, 148 patients were included in this study. Out of 148 patients, 11 patients were in pediatric age group, and the rest of them were adults. 107 were male patients within, as I said, the pediatric population. Our age ranged from 9 months to 78 years. Then we also made the etiology for long-term CBC into two groups. One was like a few kids, few adults required uh, total parenteral nutrition for intestinal failure support. The second indication was the hours like a tunnel line for the dialysis. So the majority of the population was tunnel dialysis catheters, which included 106 patients. Rest 42 of them required a TPN for intestinal failure support. So the results, there were only 3 documented line infections in 148 patients, which we use this molecule. The 3 organisms were Pseudomonas, Klebsiella, and Candida. So all the 3 infections were seen in pediatric age groups, and no adult population had any documented line infection when we started using this SQ53. Then when we saw these 3 documented line infections, we did a root cause analysis. In 2 cases, actually, the patient had switched to alcohol wipes because they had run out of SQ53 wipes, which were provided to them. So they basically switched over to alcohol wipes, and that is when they had these line infections. And one child had line infection within 48 hours of discharge to home nursing, and he growed candida. Uh, in spite of our thorough investigation, we couldn't discern the cause for this event. Then 5 patients, that is 3% of the population, had fevers, but there was no evidence of any positive cultures. So the source could have been something else because they were quite sick patients. Then the patients again were treated with antibiotic lock and discontinuation of access to the line for a period of 72 hours before restarting them, and we continue to use this SQ53 wipe. So the mean catheter days in our group was 425 days. So the minimum range was 200 days and the maximum was 912, like almost 2.5 to 3 years. I also have one patient who carried on for 4 years. Then with a mean follow-up of 21 months. So 3 patients required reinsertion of central line because of morbidity. 2 patients died with functional catheter, like they had cardiovascular events and they died with a functional catheter. 146 patients are alive and doing well. So basically, we concluded that the use of SQ53, a novel patented biocide antimicrobial solution, as an adjunct to the standard insertion and cleaning regimens, it significantly dropped the CLABSIs per 365 catheter days from mean of 48. Like before we started using SQ53, our CLABSIS rate used to be 48 um, per 365 catheter days. But once we started using SQ53, it came down to 3. So our study has demonstrated that a single easy to intervention with sterile SQ53 impregnated wipes had significantly brought down the CLABSIS. And it was a dramatic change from 48 to 3. And SQ53 is an intervention that is available in different concentrations. As I told, that it can be a hand wipe, or it can be a hand rub, or it can be a substitute to betadine, which we use, and also the common use form, that is wipe. Then the ease, since the ease of application is very, very easy, anyone can use it, right from the patient himself, patient attenders, or even the nursing staff. Everyone can use this sterile SQ53 wipes. So since it is very easily usable, so the adherent rate by the patient population is very, very good. So every patient can use this SQ53. So it's a very good intervention with a lot of promise, and a validated study which we had done. So it's a good intervention which can probably decrease our CLABSIS, and thereby decrease the cost spent on these catheters. Thank you.